This morning, I ordered 1,050 members of our Ohio National Guard into our hospitals to help our hospitals deal with the very serious situation that they are now facing. In addition to that, we are now working with an Ohio healthcare staffing company to help our hospitals meet their staffing needs. This will allow for Ohio hospitals to bring in qualified nurses and other medical personnel from out of state to fill needed positions and help ease some of the pressure on hospitals and their staff over the critical holiday period. While the staff will be concentrated in the places where they're most needed, the entire state will feel relief as the arrangement supports the coordination of patient care that has been happening really since the beginning of this pandemic. Ohio has had a unique plan that we have executed every single day since the pandemic started, of great coordination with our office, along with their hospitals, where the larger hospitals were helping the smaller hospitals, and where unprecedented coordination was taking place. That continues. Earlier in the pandemic, our concern in our hospitals was about beds, was about space. Today, it is about personnel. 22 months of this pandemic has taken its toll on our healthcare workers. And that is certainly understandable. We cannot thank them enough for the work that they have done and the work that they continue to do. 22 months they have fought this war. And I want to thank them and thank them again. We are very, very grateful. In a call this morning that I had with hospitals over our state, one of the administrators told me about a story that's kind of typical of what our hospital personnel, our nurses and others are doing. He talked about nurses at his hospital. They got off at 4 p.m. the other day, went home, maybe got something to eat, got a little sleep. They were back at the hospital again by midnight that night, taking care of patients. This is happening all over the state of Ohio. This pressure, the stress that they're facing is unprecedented. Let's look at it by the numbers. Today we have 4,723 of our fellow Ohioans who are in our hospitals because of COVID. Now, to put this in perspective, this is the highest number of patients we have had in our hospital from COVID since December 2020. In fact, the date was December 22nd, 2020. We are also approaching an all-time high number. We're not too far away. As a result of this high patient count and hospitals being understaffed, almost all hospitals in Zone 1, which is the northern part, going right across the northern part of the state of Ohio, almost all of those hospitals have stopped elective surgeries. Those in the middle tier, some have already paused, and we are told that others will be pausing in the near future. Those in the southern tier are making plans now to do that when that is necessary. This, I think, demonstrates the gravity of the situation that we are in. This is the situation that our hospital administrators described to me. Really a perfect storm. One, we are now at a very, very, very high level of this delta. Number of cases, number of people in hospitals. The much more highly contagious Omicron is here, and it's fast spreading in the state of Ohio, as it has everywhere else. Number three, flu season has almost started. And the professionals tell me that they expect a regular flu season. Last year, we did not have a regular flu season. It was very, very low. It's because people were being very, very cautious. Many people wearing masks. Professionals expect a regular flu season, and flu season is just now starting to kick in. All those are factors. When you add to that, we're entering now the holiday season. People are gathering together. And again, we're at a point 22 months into this or so when our medical personnel have just been slammed. All of this constitutes this perfect storm. Our high COVID hospital count is being driven primarily by the unvaccinated. 9 out of 10 people who have COVID in our hospital are unvaccinated. That is just the facts. Yet, there is hope. And I want to share some good news as we go back and look at the statistics. Let's start with people getting their first shots. In November, 294,000 Ohioans for the first time got a shot, got the vaccine. 294,000 in November, and in December, in the first 2 weeks, 101,000 Ohioans got their first shot. This is good news. Ohioans who had not gotten their shot are getting it. This constitutes almost 400,000 Ohioans in the last 6 weeks. Booster shots. We all know now how powerful the booster shots are. Each day we learn more and more about how well they work. In November, 945,000 Ohioans got their booster shot. And in December so far, 514,000 Ohioans have gotten their booster shot. Pushing now close to 1.5 million Ohioans getting their booster shot in the last 6 weeks or so. First shots, more people getting first shots, more people getting booster shots are certainly powerful and a way to get our hospitals more back to normal. Further, with the Delta variant being very high and Omicron spreading fast in Ohio, now is clearly the time for all of us to exercise caution, to be careful. We ask on behalf of the hospitals, if you are going to the emergency room only to be tested, please don't go to the emergency room. There's ample opportunities, other places to go. That just slows down in the emergency room the hospital's ability to care for those who are very sick and who are in the emergency room and need immediate care. If you have a problem, do not hesitate to go to the emergency room, but we ask people not to go there just to get their testing done. I would also suggest that for the next 4 weeks or so, however long this perfect storm lasts, that schools continue to mask or to go back to masking. Again, I want to thank our medical personnel, our men and women who are out there fighting every single day. We owe them so very much. A final note in regard to the National Guard. I said there was 1,050 members of the Ohio National Guard who at this point we are putting into hospitals. We expect that to start on Monday. Of that 1,050, 150 of them are highly trained medical personnel, nurses, EMT, but the hospitals have also requested that we send them other people, 900 non-medical. They will deal with many things to help the hospitals in this time of great crisis. It will involve transport within the hospital, food, and the environmental work that goes on in hospitals and is so very important every single day. We will continue to monitor the situation, and I know that General Harris will continue to look and go through the rosters of the National Guard. What we did not want to do is be in a position where we were taking someone out of their day job in a hospital and then putting them in another hospital, or taking them out of a medical clinic and putting them in the hospital. It just makes no sense. And so what General Harris and his team have done is gone through, and these 150 represent people that we would not be seeing that trade-off, robbing Peter to pay Paul. We don't want to be doing that. But the general will continue at my direction to take a look at the guard personnel, and we'll continue to work with the hospitals. We'll be happy to take questions.
Governor, first question is from Dan DeRose at WOIO in Cleveland. He asked, Metro Health announced this week that they are at their highest capacity ever. Last week, Cleveland Clinic said they were at 95%. We keep hearing 95% of those in the hospital are unvaccinated. So how frustrated are you that more people didn't get vaccinated and continue to say vaccines don't work?
Well, it doesn't do me any good to be frustrated about anything. Frankly, I deal with the world as we find it. And, my job is to focus on what we can do. So putting these members of the National Guard, over 1,000 of them in our hospitals very quickly is something we can do. Work with the staffing organization. We're not quite done with that yet, but that's going to be available in the next several days. I know the Hospital Association is working very closely with our team. That is something that we can do. We can bring in outside nurses, medical personnel from other states. We do not want to be taking it from our neighbors. If you look at the states that are highest, we have 4 states, and they're all our neighbors that are our highest. I think we start with Michigan. The top 4 are Michigan, Pennsylvania, Indiana, and Ohio. And I think Ohio's 3rd out of that. But we don't want to take them from there. But there are states that are not seeing what we're seeing. And so we think that is a very tangible thing to do. So these are 2 things that we're doing that we think will, in fact, make a difference. We would just encourage people to get their vaccinations. As I said, we're getting a lot of people who are getting their vaccinations for the first time now. We're also getting a lot of people getting their booster shots. But still, we've got less than half the people who've gotten their initial shots. Only less than half of them, I think it's like 45%, have gotten their booster shots. We've got great room to grow in regard to booster shots as well. That's what we need to do.
Governor, the next question is from Anna Staver at the USA Today Gannett, Ohio Bureau. She asks, we know doctors and nurses across Ohio and across the country are experiencing burnout. My neighbor is an ICU nurse who recently had to take several days off for mental health reasons. Bringing in more staff will help, but what else can be done to manage the need for increased time off to recover/recharge against the pressing need for more COVID staff? Could the COVID federal dollars be used to, say, provide counseling or other supports for hospital staff?
Well, those are all ideas that we should look at, and we will. We're in constant contact with our hospitals. They're seeing it firsthand. They're seeing it every single day. And look, all of this is understandable. 22 months of this, and it's very understandable why people are burned out. It's very understandable why people are tired. It's understandable why people are discouraged. And, we will do certainly whatever we can to be of help.
The next question is from Jim Province at the Toledo Blade. He asks, a year ago during the worst of the winter surge, Ohioans had the promise of new vaccines that dragged down new infections. Today, nearly 60% of all eligible Ohioans are fully vaccinated, and many of them have gotten boosted. Yet the rate of new infections is again rivaling what we saw last winter. Other than essentially treating the symptoms, as with today's hospital staffing announcement, what tools does state government have to stifle the spread?
Jim, I think we have to look at this from the perspective of who's in the hospital. The Omicron variant that is coming and is going to sweep across this state. I'm told from the Cleveland Clinic this morning a significant number of the cases that they are seeing as they do some initial testing indicates that Omicron is already, spreading very quickly in the northern part of the state, particularly the northeastern part of the state. So a lot more people are going to get infected. I think the goal will go back to kind of what we said at the beginning of this pandemic. We listed the things that we were worried about. And one of the top things has always been our hospitals be overwhelmed to the point where the care for those who are in there for heart attacks, auto accidents, cancer, where that care is imperiled. That is a huge, huge concern, and it affects every single Ohioan because it could be your loved one, could be your daughter, your son, your mother, your wife, your husband, who's in a dire situation and needs to get immediate care. And having the hospital have that many COVID people in there and not having the staff directly impacts that. So hospitalization is what we need at this point to really, really focus on. We know that booster shots are huge in keeping people out of the hospital. We also know that first shots are huge. Again, we go back, we're somewhere between 90 and 95% of those who go into our hospitals are not vaccinated. So it's very simple. If we had more people vaccinated, we will cut down those numbers. Second, we're seeing the power of the booster shot, and it works to keep people out. So we can expect to see more breakthrough cases. All the experts tell us that as Omicron comes, but our battle really has to be to keep people out of the hospitals. And we know what works in that. And I think what we need to do is continue to focus on that. The numbers I gave show that we have had a lot of people get their first shots. More, frankly, when I looked at the numbers, it was more than I thought. And I look at these numbers every day, but we've also had, a lot of people getting their booster shots. Got to have more of it.
Next question is from Adrienne Robbins at WCMH in Columbus. She asks, on Monday, you said bringing in the National Guard was a difficult decision because the nurses and doctors are taken from their civilian jobs. What has changed in the past week to warrant this decision?
Nothing's changed. It's always a difficult decision to bring in the National Guard, or it's always it's not a decision, maybe a better way of saying it, it's not a decision to be made lightly. But what I said on Monday is still true today. We do not want to cannibalize a hospital, take a nurse out of a hospital who's in the National Guard in her day job, and then, or his day job, and then put them somewhere else. Doesn't make any sense. The 150 that General Harris has identified do not come under that category. These are not people who we're moving from one hospital to another. And the General's gone through this with his team very, very carefully.
Governor, next question is from Lindsay Mills at WBNS. She asks, will the National Guard be only used through the end of the year? Is there a timeline for their deployment?
There's no timeline. We're going to keep them in there as long as they're needed. We've got to do what we have to do. So.
Next question is from Spencer Hickey at Hannah News. He asks, can the governor discuss what role the National Guard will serve as hospitals? Will they be doctors, nurses, et cetera, or other positions?
Well, the 150 are my understanding, primarily EMTs and nurses. So they will assume those normal roles. We will work with the hospitals. The hospitals will make those decisions how they are deployed. This 150 will be deployed strategically. That's been an agreement among all hospitals throughout the state. Let's deploy them strategically. What that means is at this point in the pandemic, a great focus is going to be on the Cleveland area, the Canton area, the Akron area. That's where at Worcester, that's the area we're seeing the most dire situation at this point. So those 150, our plan is for them to be focused there, at least at this point. And the 900 remaining, we anticipate they'll go anywhere in the state that they're needed, and that decision will, have to be made again on a need basis, but that can be any place in the state.
John London from WLWT in Cincinnati asks, he wants to know how soon Guard members will be in hospitals, and is it open-ended or only through the holiday?
Yeah, open-ended, and we hope first Guard members will be walking in the doors of hospitals on Monday.
Andy Chow from Ohio Public Radio and Television asks, earlier this week, the governor said he didn't want to send National Guard members because those are already healthcare staff members working with Ohio. Will this order to dispatch Ohio National Guard members be pulling some from Ohio hospitals to send to other Ohio hospitals?
No, that's, General and his team have tried to be very, very careful about that and very mindful about that. And that's a good point. Yes, we're not going to do that.
Jordan Laird from the Dayton Daily News asked, where are these national